Okay, let's continue filling in the information that we left off at the last video. And again, we're talking about the hands. We know the hands have three parts. The carpals, which is what we're going to actually talk about. The metacarpals is those bones that's actually in the fleshy part of your hand, starting numbered from the thumb over to the little finger, 1 through 5. So we have first, second, third, fourth, fifth metacarpal. And then the actual bones of the fingers and the thumb being called the pollex themselves. And so you have the proximal, middle, and distal, but the thumb only has the proximal and distal. Okay, but what we want to key in on, again, are the carpals. So there are 8 bones in the carpal, the wrist bones. Okay, so the top set of bones, there are 4 bones in the top area. They are the scaphoid, the lunate, and you can actually use either one of these terms. I prefer triangular, but if you want to use triquetrum, that's fine too. But triangular is probably easier to remember. And then pisiform. So there's a little saying that if we get the saying down, we can keep the bones in order. The saying is, some little tiny people, and then the next row of bones is the trapezium, trapezoid, capitate, and hamate. All of these actually border and touch the metacarpals. None of the top row borders the metacarpals. So if I remember my saying, some little tiny people try to chew ham, then it will help me, once I learn the words, it will help me keep them in the correct order. Now, the scaphoid always, the top and bottom row, we always start on the thumb side of the hand to determine this. So let's look at our picture again and go through our little saying. And because if you memorize this saying, or there are other sayings, and I'm going to make a video available that has a different saying, but it also counts it differently. So choose one or the other, and then apply that mnemonic, and I think you'll be able to get it pretty quickly. Okay, so again, here's my top 4 bones, understanding that this bone is sitting on top of that one, and this will be considered our last bone on the top row. But none of these bones here are touching our metacarpals. But my second row of bones, every one of them actually border the metacarpals. So always start, there's the thumb side, always start on the thumb side in my counting or my saying. So notice, this is on my thumb side, but it's not touching that, so it's my top row. Some, my next bone little, my next bone tiny, and my next bone people. Then I put the word some is scaphoid, little is lunate, tiny is triquetrum or triangular, and people is pisiform. Then I start on my next row, try to chew ham. Now if I start on this side, thumb over, then I have to start my second row the same way. So try is trapezium, two is trapezoid, chew is capitate, and ham is hamate. And another couple of things, trapezium and trapezoid do sound kind of alike. So you do have to make sure you distinguish them. And then the hamate bone actually does have a hook. That little area is a hook. So I just think of the ham with a hook on it as my last bone. But again, notice it has a border against my 5th metacarpal, my 4th metacarpal, 3rd metacarpal, 2nd and 1st metacarpals. All these have borders this last row. So I've spent a lot of time telling you about this, so you will definitely need to know it. Now, if I were to ask you, well, what is this bone right here? You would say it's the middle phalange of the 3rd metacarpal. If I were to ask, what's this bone? You would say it's the distal phalange of the 5th metacarpal. If I ask, what's this bone? It's the proximal phalange of the 1st metacarpal. So that finishes up the hand. We move to the pelvic area. You're used to seeing what's called the pelvic girdle, which would include the sacrum and the coccyx. But now we're talking about the actual bones that attach to the sacrum and coccyx. And we have what's called the os coxa bone, which is literally made up of 3 fused areas, the ilium, the ischium, and the pubis. They literally are 3 different bones, and they have their own parts. Let's look at that real quick. We've looked at it earlier, but let's look at it again real quick. The whole bone is the os coxae. The whole bone is the os coxae. Here, the upper half of the bone is the ilium. The back half of the lower side is the ischium. It has this curved area. And then the front area with kind of pointed area is the pubis. and then where one side would meet the other would be the pubic symphysis. Okay, let's look at the ilium first, and let's look at these areas. We're going to look at the iliac fossa, the auricular surface, which we saw an auricular surface actually on the sacrum, and this is actually the surface that would tie the oscoxal bone to the sacrum. It's also called an auricular surface, which means ear-like surface. Then we'll look at the greater sciatic notch, but what I want to draw your attention to, first of all, notice that we actually have these terms, and notice these terms basically are directional terms tied to iliac spine. Iliac means it's on the ilium, and spine means it's a sharp protrusion that's usually an attachment site. Okay, so we have an anterior, means front, and a posterior, which means back. We have a superior, means above, and inferior means below. So let's look at examples of all four of these. Okay, the pubis is always going to be on the front or the anterior. The ischium is always going to be on the back. So if we're looking for things here, we know that whatever's on the same side, I can follow up the same side from the pubis, will be anterior. So this sharp area, you can feel it. Sometimes you call it your hip pointer. You can feel this on your front of your hip bone. That's your anterior because it's front, superior because it's above this one, iliac spine because it's a spine on the ilium. So then below it, our anterior, it's still on the front, but it's below this, so it's inferior, but it's still an iliac spine. On the back here, I've got this a little bit more rounded spine, but it's on the posterior side, same size as the ischial tuberosity and the ischium. So it's the posterior superior iliac spine, and then below it here, kind of where this curves in, is the posterior inferior iliac spine. And then if we follow that down towards the ischium, this deep groove here is the greater sciatic notch, and your largest nerve in your body, your sciatic nerve, runs through that area. Very quickly, again, this is the front side, same side as the pubis, so there's anterior superior iliac spine. We can see it right there, anterior superior iliac spine, anterior inferior iliac spine, anterior inferior iliac spine. Then on the same side as the ischium is the posterior area, so same side on the ischium. So here's the posterior inferior iliac spine, posterior inferior iliac spine, and then you can see this kind of curved area right through here, posterior superior iliac spine, then this deep groove here, greater sciatic notch. Now this next area is the ischium, and notice it also has a spine on it. This area, very prominent area sticking out, is the ischial spine. So the ischium has the ischial tuberosity, this thickened back area, and it has this spine sticking out called the ischial spine. Okay, so we saw everything except for the auricular surface. We'll go back and see that. And then we saw the ischial spine and the ischial tuberosity. So we'll look at the auricular surface from the ilium and the ischial ramus of the ischium. Okay, this area right through here and right through here is the auricular surface. That's where this attaches to the sacrum at the auricular surface of the sacrum. And you're used to usually seeing them both together in what's called the pelvic girdle, but they actually are separate areas. Okay, and then the other area that we need to look at is this curve here, that where basically the ischium and the pubis come together. That curved area right there, curving off the rest of the bone, is the ischial ramus. So that curved area right through here, where the ischium and the pubis meet, coming off this bigger area, is the ischial ramus. So you can see ischial ramus right there. Ischial ramus right there. Okay, now, a foramen we know means a hole. So this big hole down here in the bottom of this is the obturator foramen. Obturator foramen. And then the socket area where the head of the femur will fit in is called the acetabulum. Well, we know there's an ischial ramus this area. So there's also a ramus of the pubis, but there's an inferior ramus of the pubis and a superior ramus of the pubis. And if you look at this kind of area right here where the bone forms a shadow looking like a line, if you'll just consider everything below that shadowing area, the inferior ramus of the pubis, and everything above that area running up here towards the acetabulum, the superior ramus of the pubis, then you'll be okay. Okay, so we saw the superior ramus of the pubis, the inferior ramus of the pubis, the obturator foramen, the big hole in the bottom portion, the acetabulum, which literally means vinegar cup, Of course, that's where the femur fits into it. I've already gone over these differences in males and females on the previous video. Here's a quick summary of it. So the next thing we want to look at is the femur, which we've kind of mentioned the head and the greater and lesser trochanter. We'll look at those again briefly and then talk about the rest of these features. So again, looking at our femur, that large, long leg bone, upper leg bone. Again, we see the whole thing. We see the head of the femur that would fit into the acetabulum. Now the head actually has a little hole in it with a ligament that attaches, that partially attaches the head of the femur into the acetabulum. It's called the fovea capitis. Okay, we actually have this large connective area here. That's an attachment area, I should say, greater trochanter. We have this lower area called the lesser trochanter. So again here, see the greater trochanter here, the lesser trochanter here. Now notice this is the anterior or the front, and this is the posterior or the back. So on the front, we actually have, we actually kind of have a line that connects one trochanter to the other. Inter always means between, so this is basically the line that's between the trochanters. So the intertrochanteric line is that line here. It's almost like a thick suture line. You can actually feel it, and it does. You can see it right through here connecting this trochanter to this. But in the back, it's not just a line, it's literally a crest. You could stick your finger in this. It's thick enough to where you could rest your finger inside of this, but again, it's intertrochanteric, therefore it's connecting the greater trochanter to the lesser trochanter, but it's much deeper in the back than it is in the front. Now, one of the other distinguishing characteristics, if you know the head is always going to point medially, and then the deep groove behind the condyles, remember condyles are rounded articulating areas, the deep groove is called the intercondylar between the condyles fossa, fossa being a groove. Okay, so that's always going to be in the back. Now, we have a very pronounced neck from the head. We've got this very, much more pronounced neck in the femur than it was in the humerus, even though the humerus and the femur have a lot of similar features. Okay, now if we know the head is on the medial side, then we know that this condyle on the same side as the head is the medial condyle. Therefore, the condyle on the opposite side of the head is the lateral condyle. So here, this condyle is going to be on the same side of the head, so that's going to make that the lateral condyle. We know epicondyles are bumps on the side of condyles. So that's a lateral condyle. This bump on the side of it is a lateral epicondyle. Again, if that's a medial condyle, this bump on the side of it is a medial epicondyle. Okay, one thing we see on the posterior surface of it almost gives the bone, instead of a circular shape, almost a triangular shape, is this line running in the back, which is a major attachment site for muscles. It's called the linea aspera, and it's this line on the back. Of course, we don't see it on the front. The front is a little bit more rounded. The back, though, this almost comes to like an angle, so it almost makes it a triangular shape, but this is called the linea aspera. Okay, our knee bone's called the patella, has a pointed area at the bottom of it called an apex, a flatter area at the top called a base. We see that terminology used for those shapes on other organs. Here we see the flatter upper area. Here we see the more pointed lower area. So the apex, the front, the lower area, the base, the top area. Okay, I'm a real stickler on these next two bones because we have something called a tibia. We have something called a fibula. What we do not have is something called a fibia or a tibula. So if anybody ever writes fibia on a test or tibula on a test, that is definitely a wrong answer no matter what else you say about it or put down there. And I've actually heard on certain sports shows like ESPN or something, somebody talking about somebody broke their fibia, and obviously they didn't because there's no such thing as a fibia. So we will continue the video, and it will be a short video where we'll talk about the tibia, the fibula, and the rest of the foot.